Hi everyone. In this PowerPoint, we're going to talk about prevention of aspiration. We'll go over which foods are safe for people that have trouble swallowing and which foods to avoid. We'll also talk about techniques for safer swallowing, and we'll touch on hydration and nutrition at end of life. The safest foods for someone at risk for aspiration are thick and have a smooth consistency. On this slide, I've listed some examples of foods that are appropriate for people at risk for aspiration. If you look at the top picture, this is a very typical plate of someone that is on a dysphagia diet or a diet for people that have difficulty swallowing. It's not always appetizing, and it can be a struggle because people don't want to eat it. It's all the same consistency. It doesn't look good. The texture is all the same. Another difficult thing is that thickened liquids, which on the bottom right I have a picture of a very popular brand of thickener. This is pre-thickened coffee mix. Drinking thickened liquids, even if you're drinking a fresh, cold glass of thick water, it just doesn't feel right. It doesn't taste any different than water, but your brain just cannot wrap your head around that it's water because it just is it's so thick. And that's hard because patients don't always want to drink or eat these consistencies, and then they don't get enough hydration or nutrition. So some examples of foods that are appropriate are thickened liquids. Sometimes they come pre-thickened, or sometimes you can add a powder to them. Custards, yogurts, puddings, or mousses. You can think those are already pretty thick. Milkshakes or eggnog, that might be appropriate depending on the level of difficulty swallowing. Smooth mashed potatoes with gravy, that's a great example. Mashed bananas are good. Applesauce is normally appropriate. It just needs to not be chunky. It should be smooth throughout and shouldn't have too much excess liquid in it. And then pureed meats, fruits, or vegetables, anything pureed without lumps or seeds. Same with the blended food. They just need to be a single texture. And then things like cereal that has been soaked with milk and then drained of excess milk. Another good example of something like that would be cake. It's okay to give a patient that has trouble swallowing cake, but you might need to get it wet with milk first so that it's not crumbly. This slide talks about how to identify foods that are dangerous for someone at risk for aspiration. So I just want everyone to kind of imagine that you're tired, maybe confused and weak. And then imagine that someone has put a spoonful of water in your mouth versus a spoonful of pudding. You can probably imagine that the pudding is not going to drip down your throat without you swallowing, but the water can definitely, and it can be easily aspirated. Okay, so thin liquids obviously are dangerous. Anything that can be inhaled into the lungs, things that are powdery or can crumble easily, foods that have any seeds or lumps, foods that aren't the same consistency throughout, foods that are juicy, and the reason for that is because, again, with the thin liquid, when you're eating something that's juicy, there's going to be thin liquid that comes out of it. And then food with pit. On this slide, I've placed some examples of foods that are dangerous for people at risk for aspiration. I want to just say I very often have family members questioning their loved one's diet at work. They don't understand, why can't they have bread? It's just bread. They don't realize that bread, if you're not chewing it thoroughly and salivating like someone that's healthy, is crumbly and dry. It's a lot of little pieces that can easily be inhaled into your lungs or go down the wrong way. Okay, so some examples are regular water, hard-boiled eggs. Just imagine how crumbly that yolk can be. Dry bread, crackers, cake, or pastries. And this, like I said in the previous slide, some of these are going to be okay as long as you moisten them first. Rice or scrambled eggs, again, that's because they're crumbly, small pieces. They're not smooth. The lumpy applesauce, whole fruit like watermelon, meats that are not pureed, nuts, and then some things with pits that I listed are olives, cherries, and dates. So proper positioning is a huge part of prevention of aspiration, and it really is pretty easy. The head of the bed or the patient's head should just be as high as possible during eating and for about 30 to 45 minutes after eating. So 90 degrees is optimal, and it should never be below 45 degrees, and that's really only if the patient can't tolerate it. So 90 degrees is definitely the goal. Here's an example of exactly what 90 and 45 degrees looks like. Here are some techniques for safer eating. Positioning, like we talked about, with the head of the bed being elevated. Also, it's best for the person feeding the patient to be at the same level or below the patient while feeding them. And when the patient swallows, it sometimes helps if they put their chin down and out towards their chest while they're swallowing. Encourage them to eat slowly, chew thoroughly, don't talk while they're eating, turn off the TV, reduce any environmental stimuli that might distract the patient. You want to check for pocketing. Now, sometimes patients that have trouble swallowing will have food kind of stored in their cheeks, and that can be very dangerous if you don't get that out. Straws are often avoided with people that can't swallow. And then the placement of food is important. So if a patient has had a stroke and they're weak on the left side, you want to make sure you actually place the food on the right side when you're feeding them. And then it should be obvious not to feed someone that is unconscious or sleepy, but I have had people pour soup down patients' throats that are unconscious, and many times. People just don't realize you can't feed someone that is not awake and alert enough to safely swallow. Now I want to touch on hydration and nutrition at end of life. I was a hospice nurse for 7 years, so I do have a lot of experience with this, and it really is the hardest thing to teach families because it's people don't want their loved ones to struggle, and they think that holding nutrition and hydration is causing discomfort. So something that I like to tell people is just, the same way that our bodies know how to be born, we also know how to die. So hunger and thirst stop for a reason, and it's a completely normal part of the dying process. You're not moving as much. Your digestive system is slowing down. Your body needs to focus on your brain and your heart. So your stomach is probably the least important thing. It just starts slowing down. You also don't need the nutrition like somebody that is actively moving around would. Some people believe that one of the reasons we stop drinking at end of life is because dehydration can lead to a release of endorphins and actually cause a feeling of euphoria, which can obviously decrease pain and make the dying process more comfortable. And then also your organs are shutting down, so the fluid that you're putting in your body might not be processed, and that can cause a lot of discomfort for patients. If it's not being processed, it's going to stay in your lungs or your legs. You're going to be swollen. You're going to have fluid in your lungs. It can be very uncomfortable. And this is our last slide, and it talks about aspiration pneumonia, which happens after food has been aspirated into the lungs. So foods and liquids are meant to enter your stomach through the throat. When foods and liquids are aspirated, they enter into your lungs instead. This can cause aspiration pneumonia, which can be very uncomfortable. It can cause pain, shortness of breath. It can kill you, and it requires strong treatments with medications like steroids or antibiotics.